This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about how you can tell if you have carpal tunnel syndrome. If you like this video, we put out new content weekly, so please like and subscribe. So if you have carpal tunnel syndrome, you'll have numbness of your hand, usually in your thumb, your index finger, your middle finger, and half of your ring finger. Your pinky and the other half of your ring finger are usually innervated by a different nerve called the ulnar nerve, which is more in the elbow. Now there's some anatomic variance, but for the most part, by and large, if you have carpal tunnel syndrome, you'll have numbness or tingling in those areas. You'll most often notice it at night. So what happens is the median nerve, which supplies the sensation of those fingers and some muscles to your hand, travels in your wrist like this. And when we sleep at night, we tend to sleep like this, and that kind of crushes that nerve or decreases the space in the carpal tunnel. And what will happen is people will end up getting tingling more so at night, where they have to wake up and shake out their hands. So if you're having symptoms like that, chances are you have carpal tunnel. Most of the time, for most people, it's just numbness and tingling sometimes. With other people, it can progress to where you get it more all the time, and then if it's really there for a long time, your hand will be constantly numb, and you'll actually lose muscle mass in your thumb, which usually you can't get back if it's progressed that far, which I've seen before, which is usually rare. So again, to tell if you have carpal tunnel, numbness in the thumb, index finger, middle finger, half the ring finger, notice it at night, or sometimes when you do other activities that'll kind of force your wrist into extension or flexion. The first line of treatment is to wear a carpal tunnel splint at night, and there's other sorts of things like therapy you can do, or start nerve gliding exercises, sometimes a steroid injection, and then if that all fails, surgery. But again, if you have those symptoms, you're waking up at night, you're shaking out your hands, and your hands tingly in those areas where I just talked about, then you probably have carpal tunnel syndrome. So I hope I was able to answer your questions about how to tell if you have carpal tunnel syndrome. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond, but note that I can't give you specific medical advice about your condition. And again, if you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.